It's me, your son. I'm going to make a quick video about elbow-itis, or lateral epicondylitis, or medial epicondylitis, or my elbow hurts. So essentially, you want your tissues. There's a concept called sliding surface mechanics. We have skin, fascia, muscle, bone, essentially. And all this shit needs to slide in a wet, lubricated system evenly and without restriction. Through exercise, recovery, the natural process of healing, scar tissue forms in between these layers. They will get adhesions between them that will start off looking like cobwebs. Eventually, it'll get thicker and thicker until you develop fibroids. And those fibroids will get thicker and thicker, and it might be felt as a knot or like just really hard, lumpy muscle. You might have referred pain when people feel around those adhesions. The tissue will get stiffer, weaker, shorter, more brittle. It's bad, essentially, right? The scar tissue will occlude and clog up your lymph system, and so there's a lot of broad-reaching implications for systemic formation and the management of that formation of the scar tissue. So, that being said, along with scar tissue, just using our muscles is hard on them, right? And if we don't get ahead of our recovery, and we are breaking down those muscles faster than they are able to, deal with that breakdown and adapt, then over time they're going to get weaker, and they're going to get hot, and they're going to get inflamed. Additional scar tissue will be formed in those areas because the muscles are stressed out. That chronic inflammation will further occlude healthy circulation, and then essentially those tight muscles will yank on ligaments that attach to the joint, and it's an issue. So if your elbow hurts, we go downstream and we go upstream, and this way we make sure we capture the systems on both sides of the elbow that could be contributing to that pain. So the best and first place to start is mid forearm with the band, and it's a little awkward at first, but just get it on there. Let's see, it's too loose. There we go. And I fucked this up. To get a lot of pressure and tension, you want it to be painful but not excruciating. Use your best judgment. You obviously have nerve and vascular bundles that run through the front of your elbow here. Start slow at first, and with lighter compression, and then get more and more heavy compression as you get used to it. So you'll see here, I started this far down my forearm most of the way, and then I went just past my elbow. So now what I'm going to do is tuck the band in here and run my hand through its normal range of motion, and this is not comfortable at all. And then I'm going to bend my elbow. You'll see it's popping out there. It's fine, as much as possible. Up and down. You don't want it to detach like that. So keep bending it, and make sure that thing's tucked in there good. And then last thing, we're going to want to grab it and basically Indian burn our fascia from the inside out. So I'm going to twist my arm towards myself and move the band away. And then I'm going to twist away from myself and move the band towards me. Indian burning myself from the inside out. So that also doesn't feel good. Then, after that's been on there for about 2 minutes, I'm going to go ahead and roll this guy back up. So now I can feel blood rushing back into my arm. I'm moving fast to roll this up. If your hand goes numb, even quite numb, that's fine. It just means you should finish up that current wrap in about 30 seconds. It's not necessarily dangerous. I say that with the caveat of, obviously, you could hurt yourself doing this, but I've never seen it done in the 3 years that I've been using and teaching these techniques. Just don't be a ridiculous idiot. And I don't think we need to worry about that with you. So this time, I'm going to make sure this is tucked in better. This is the technique I'll use. I'll put my finger down and then make it a tighter hold at first. So we're going to get more tension on. I'm starting pretty much just right below my elbow. Really tight on the back, still tight but less tight on the front. Really tight on the back, less tight on the front. Going all the way around. And this time, because of the extra tension I have and the stretch, and then also because I started higher up on the forearm, the band will end up about halfway up my bicep, hopefully. And then, you know, you'll get better at the technique of using the band as you practice. So then what we're going to do is, again, bend the elbow. You'll probably be able to have less flexion this time because of the straight up tightness right across your elbow. So we're just bending a little bit. Ooh, oh, that's not comfortable. Fight for that bend. Alright, again with the forearm. We want full extension as well. So what I like to do here, let's see if this works, is I will hook my hand in my leg like this and pull myself to full extension. I'm here, I'm pulling my elbow into hyperextension, just pulling it longwise and against the natural angle of my elbow, just stretching that joint out gently but firmly. I'm going to relax, I'm going to contract. Here we go. I actually have been doing a lot of straight arm gymnastics work. My elbow's pretty hot, so this will be nice. So again, once that's been on there for a minute or two, you can go ahead and unwrap it. Oh, that feels great to get that off. I'm going to go ahead and wrap this up. The time it takes to wind these, I find, is a good amount of time for the blood to come rushing back into your forearm. So for this next one, we're going to start, you guessed it, right below the elbow and go pretty high up into the upper arm there, past halfway up your bicep. So this is going to be excellent because it's going to catch the lower and upper insertion of a few of your triceps, pretty much your whole bicep, and this will completely take care of the systems directly affecting your elbow. Now it's important to note out that if you have specific issues upstream of your elbow, joint-wise, we're going to be dealing with your shoulder and potentially the way you carry your whole entire left arm. Maybe your shoulder is just internally rotated, and so that forces your elbow to externally rotate, putting extra stress on it throughout the day. Now up here, I'm going tight around my whole entire upper arm because the nerve and vascular bundles are both moderately protected by my tricep and bicep muscles. As I get higher, boom. So I'm pretty much here up into my lower delt insertions, catching the whole bicep, really tight across the top. I'll go ahead and tuck this guy in. So generally, I'm actually not using very good technique as I'm wrapping here. Trying to get a good compression since I'm actually injured. You don't need to have two hands to do this stuff, and so you can just hold the band on with your offhand, but it's good to be able to wrap like this so that you can have offhand and help yourself bend. So again, not a ton of flexion here, just a little bit. The elbow joint is compressed, and we don't want to force all those tissues to go through their full range of motion in this kind of compression. So again, with the inside out Indian burn stuff, twisting towards, pushing away, reverse, all the way up and down. So if you find that your hand is getting numb faster and faster, that's alright. We don't need to spend 6 minutes on your whole arm. You could do 1 minute, 1 minute, 1 minute, and that will be fine as well. The thing is, you can do this a couple times a day. If you notice that you're super, super sore, do it more gently. This compression will help with recovery in general, but we are breaking down a lot of scar tissue, and scar tissue is innervated and it has circulation. There's infrastructure that's healthy that goes along with it that we're going to have to take some time for that stuff to break down too. Scar tissue is missed when it's destroyed, just like any other tissue. So my hand's pretty numb. I'll give it about another 20 seconds here. It's cranking along, a little bit of flexion. Really, you see how vascular my forearm is, the veins popping out. I have pretty intense tingles now. I'm going to go ahead and take that off. Oh, and this time it feels amazing. If you keep a stretch on as you take the band off, it won't cut you because of the shear force across the edge as it unwraps itself. Just keep twisting it. Ah. Whew. And so you see the color change, yellow, whew, red, rushing red in there. My arm is bright red, and that feels awesome. So I'm going to give my arm a second to fill in with blood. I'm going to go ahead and wrap this up. So what we just did there is called intermittent compression. And so we compress forearm, elbow, or forearm and elbow, and a little up and downstream, and then elbow and upper arm. So all my tissues through here are pretty goopy. My arm is hot. I broke a sweat in my forehead. So I'm going to wind this up. Oh, that feels great. And so this is a technique I will use to wind, just kind of like a spool. Wind, wind, wind. And it doesn't have to be super tight or super neat. I'm just getting it done because I'm just going to wrap it right up again. As long as it's not so messy that you can't wrap well, that'll be okay. So now we're going to talk a little bit about ART therapy to let the blood keep rushing back in my arm. So active release therapy or active release techniques is a specific self-massage technique. And you can spend a lot of money on certifications and stuff, which I will eventually, but the gist of it is you extend the system being the elbow and the forearm. You put tension in the system. You can see the bellies of my muscle. You basically just want to get in between them with your forearm, or with your fingers, not your thumb. And so you see, you can make your fingers like a blade, and so you just apply that blade directly in between the bellies of the muscle. So for you, it's going to be right here. It's going to be a big one, right on the outside of the forearm, and potentially on the underside too. You can get between the muscle and the bone. You just contract, relax, and sink deeper. Oscillate your way in, get nice penetration, and then crank that sucker through its normal range of motion. Big circles with your forehand. Go slow with your hand, rather, forehand. You can extend, palpate that sucker to death. So shear force like this, oscillating up and down. You can think of your hands like a blade, and you're just trying to into the muscle. It should not be comfortable. It hurts like a bitch. You've had it done to you by me a little bit, but it really works. It's worth it. So also, applying that force straight in, and then scraping across. We really want to get in the front of a muscle belly, and then try and pull that muscle off of another muscle. And this is taking care of the adhesions between the different compartments of these specific tissues. So then upstream, same thing. You find the spot that hurts, get in there, and then shear force the heck out of it. Just grind down that scar tissue. Come up to your bicep. I say bicep for a reason. You can get between the bellies of your bicep, and floss those motherfuckers through their normal range of motion. Just crank on it for a while. Full range of motion, oscillating for deeper penetration with your fingers, grinding back and forth. Also, you can get in between your humerus and your bicep and scrape back, peeling the bicep off of the femur to make sure that there's no adhesions grinding them or restricting them. So you work downstream near the biceps tendon. Be aware that your biceps, up here is two distinct muscle bellies. They turn into one, and then you have a tendon that attaches to your elbow, right? And so we don't want to do this intense shear force on any tendons, only muscles and around those. So we be gentle around the tendons. They take a lot longer to heal, and so this technique isn't good for them because they can't keep up recovery-wise. So just kind of pinching back and forth around the beginning of the biceps tendon, just oscillating, that friction. So you can also come up here into the lower delt insertion, upper biceps insertion, floss back and forth. And so I'm basically just grinding through here, separating my shoulder muscle from my bicep. And it's not comfortable. So That's ART therapy, and it might seem like a little specific. You don't need to know anatomy. Honestly, the best thing you could do is just Google forearm muscle anatomy, and then look and be like, oh, okay, there's that on me, and then just get in between there. That shear force thing is a great technique. So obviously this is not too specific. Next, the last piece of band technique we're going to do. Really tight downstream on the outside, and come up, and then just kind of skip the elbow, so go diagonally across the back, and then really tight on the top and the bottom on the upper arm. My phone might die here any second. Whew, sucker hurts. So this is not comfortable. This is going to be called flossing. In the literature, it's referred to as the edge mobility system. And so you see here my elbow is actually exposed and it's not tightly wrapped. However, downstream and upstream directly of my elbow are very tightly wrapped. And so what I'm going to do is contract, relax my fist, twist it around, run it through its normal range of motion. And here is the sucker. This is going to fucking hurt. So you're going to take your hand and just close down that joint as much as possible. And then just floss it through that normal range of motion, really getting into the upper extremes. Just jam that sucker in there. Not super hard, just enough to close down the joint. So I'm doing it with knuckles in. This came undone. Make sure you leave the last wraparound pretty loose so that you can tuck it. Just tight enough to hold the band so that this doesn't happen in the middle. And then, so you can do it with palm up as well. Really just try to close down that joint. Don't hit yourself in the face. And then, so after a couple minutes, or when your hand gets pretty numb, take that off of there. And so that's called flossing. Before we did a series of intermittent compressions, and this was Voodoo. It's referred to as Voodoo flossing. You can do this for your knee. All those same techniques apply. With the knee, be really careful of the tendons in the back of your knee. Those are pretty delicate. And so I generally like to just do the calf and then compression with not bending my knee a lot, and then just do my quad on its own, especially since your thigh is thicker and the bands are only like 7 feet long. So now my forearm is bright red and has these straps from the rubber band, but it feels amazing, and it'll be a lot less sore tomorrow. Or, it might be more sore, but it's not going to have that pain, right? That circulation will be bustling through there all night, clearing away the junk I just destroyed, and that's the effect that we're after. So self-massage, compression, and flossing, avoiding ice, and avoiding chronic anti-inflammatory drugs like NSAIDs, because those will dull the adaptation response to the healthy inflammation we just created. This will flush out that chronic inflammation, no problem. So don't take ibuprofen or anything like that. Anyways, if you have any questions, let me know. This is about 20 minutes, so thanks for watching, and I'll see you soon.